When you're in practice or when a doctor goes in practice, I think it's important for them to really try, and I know it's difficult now with the 10-minute visits, but try to get to know your patients as a person, and then you truly realize what they're like and what their worth is. And it's not just that they came in because they had a pain in their knee or whatever. I think this is what this program does. It allows you to get to know us as human beings and friends, and sort of changes your perspective on things. Most
But you can learn an awful lot about a person just by the conversations that we had between us. You don't just, when a patient comes in, you just don't treat the condition the patient has. You treat the patient who has the condition. And once you get to know the patient, you can understand sometimes how their lifestyle affects their problems. Then at least you know how to work with them, what the ramifications are, what are their parameters. You have an idea of what to do. So it's so important. And another factor too, Louise also did a lot of sports too, but we were both basically athletes, and you are doing a lot of athletic stuff and getting hurt, and I was a marathoner, and that's why I have so many back operations and rods and screws in my back and 2 bad knees and elbows and everything. And everything changes. It may change as you get older, but now I don't walk as fast, but I can stop and I can smell the roses. I can look up at the sky and see the clouds. Before, when I was running, I just wanted to make sure that I didn't trip on anything as I ran on the roads. So perspectives change. Quality of life sometimes changes, but it can be for the good, doesn't have to be for the worse. And we both compare our injuries, our athletic injuries, and I think this also broke down the generation gap, that we're able to discuss that. And that isn't that much far off. I mean, it's just a difference in age, but we still have the same kind of problems, except a little bit more, with the age type problems.
But from my perspective about, what they were saying about getting to know people as people and treating people as people instead of just a job or, the condition, like you said, is that even though he has to do things differently because of his change in physical status, he finds a way to appreciate and have such a positive spin on everything that's happening to them, which I think is such an amazing quality and honestly inspiring to me, because I surely was not like that. But when I met them and I, through spending time with you guys, that has become more of my lifestyle, as being just a more positive person and having a more positive view on life.